What are we talking about today, Jinx? We're talking about the relationship with alcohol and ADHD, autism, and AuDHD, and how those vary. So this study analyzed data from over 21,000 respondents via the Global Drug Survey to understand how alcohol consumption, alcohol-related regret, and the desire to seek help differ between neurodivergent individuals. This means individuals that have ADHD, AuDHD, and autism. Key findings by neurotype. So the ADHD profile, high volume and impulsivity. Respondents with ADHD had the highest overall risk. Their drinking is often driven by impulsivity, sensation seeking, and drinking too much too quickly. When they experience regret, it's usually linked to impulsive decisions, chaotic behavior, or social repercussion. They were, however, more likely to engage with support services than their autistic peers. Now, the autism profile, low frequency, high dependency risk. Autistic individuals drank the least overall. However, those who did drink were highly vulnerable and more likely to fall into the possible dependence category. Instead of drinking for social facilitation or intoxication, they largely use alcohol to self-medicate, for anxiety or to numb sensory overload. Their regret usually stems from post-drinking sensory distress, and they are the least likely to seek professional help due to discomfort with conventional therapeutic environments. The AuDHD profile, the overlap. Individuals with both ADHD and autism face a compounding challenge. They reported the most frequent drunkenness, the highest levels of alcohol-related regret, and the greatest desire to reduce their drinking at 42%. Their drinking motives and subsequent regrets are a complex mix of both impulsive acts, ADHD, and sensory social discomfort. So the researchers identified regret as a highly promising intervention target. Regret was a massive predictor of wanting to change drinking habits. For the AuDHD group, specifically, experiencing regret made them over 6 times more likely to want to drink less. Despite this high desire to reduce drinking, the study highlights that standard alcohol support services are often inaccessible or unaccommodating for neurodivergent people. More research needs to look into the relationship between neurodivergence and alcohol use.